This conference will now be recorded.
Welcome, everybody. Thank you so much for attending our webinar today on mental health and ministry with young adults. And this is part 2 of our 3-part series on pastoral care for ministry with young adults. So we're so excited to have everybody joining us here today. We're very excited to have our speakers. I would like to introduce myself and Paul, and then I'll go ahead and introduce our presenters. I'm Tracy Lamont. I'm going to be sort of moderating and sort of organizing the meeting here today with Paul. I'm assistant professor of religious education at the Loyola Institute for Ministry at Loyola University, New Orleans. Before coming to Loyola, I served as a parish youth and young adult minister and worked as a high school teacher. I am also the vice chair of resources for the USCCB National Advisory Team on Young Adult Ministry. So I welcome you all so much. And then we also have Paul Jarzembowski, the fabulous Paul.
Too slow.
He works
losing our connection.
He works for the United States Catholic Conference of Bishops as the Assistant Director for Youth and Young Adult Ministries and the Secretariat for Laity, Marriage, Family Life, and Youth. Paul also serves as the staff liaison for the USCCB National Advisory Team on Young Adult Ministry. Welcome, Paul. Thank you.
Thank you. Good to be here.
Wonderful. And so Paul and I will be moderating our session today. Today we're very pleased to invite Star Young. She is currently a graduate student at the Institute of Pastoral Studies of Loyola University in Chicago, where she will receive both a Master's of Divinity and a Master's of Pastoral Counseling. Her passions are creating awareness of mental health in the African American community and ministering to young adults. She currently serves at St. Columbanus. Did I say that right?
Yes.
Oh, thank heavens. Columbanus Catholic Church on the south side of Chicago. Welcome, Star. Thank you so much for being here with us today.
Thank you for having me.
I'd also like to welcome Dr. Kristen Witt. She received her doctorate in ministry from Catholic University with an emphasis in pastoral counseling, focusing on the integration of crisis response and Roman Catholic theology and ritual. She also has acquired 3 master's degrees, teaching, spiritual and pastoral care, and theology. She has also taught school, worked as a campus minister and a youth minister. Additionally, she served in the Archdiocese of Baltimore as the coordinator of pastoral care and social justice and led domestic Catholic educational and youth engagement for Catholic Relief Services. She currently is a consultant for Loyola Press, and Kristen resides in Catonsville, Maryland, with her husband Andy and their daughter Kyra Grace. Welcome, Kristen.
Thank you. Glad to be here, Tracy.
Really wonderful to have you both. So I'm just going to turn it over to you both to invite you, Star, if you'd like to offer your reflections today on the conversations that we're very interested in having on mental health and ministry with young adults. So Paul and I will turn our cameras off and we will turn it over to our 2 presenters here. Star, you're welcome to go first if you'd like today.
Sure. Thank you, Tracy. So as Tracy mentioned, my name is Star Young, and I'm a student at Loyola University of Chicago at the Institute of Pastoral Studies. I'm studying to get my MDiv and my Master's in Pastoral Counseling. And so this webinar is right up my alley because I love talking about ministry and I love talking about mental health. And I think the two definitely complement each other. Outside of my goal of being a psychotherapist, I've been working in young adult ministry since 2011. I'm currently the leader of a ministry called RESEAL, which stands for Reclaiming Christ in Life. And it's a young adult ministry that focuses on creating a safe space for young adults to talk about their lives and to talk about their faith walk and their journeying with Jesus. So for today, as we talk about mental health and ministry and what we can do as faith leaders in the church, I think this is an important topic, mainly because those who are experiencing mental health concerns, especially young adults, and that are faithful, they will often turn to a faith leader first before they go anywhere else. So I'd like to just start out by going through some of the basics about mental health and some terms. So what do we even mean when we use the term mental health? Mental health is essentially the foundation for thinking. It is how we communicate, how we learn. It is our degree of resilience and the self-esteem that we possess. Mental health is the key to our personal well-being, it's the key to functioning, fulfilling relationships, and how we contribute to community and society. So, what is the difference between mental health and mental illness? A lot of time those terms are used interchangeably, but there's a slight difference when we use them. Mental illnesses are health conditions. They involve significant changes in thinking, emotion, or behavior, and they are associated with extreme distress or problems in our day-to-day functioning and how we function in social, working, and family activities. Mental illness is very common. About 1 in 5, or that's 19% US adults, experience some form of mental illness in a given year, and that stat
Another
is
sandwich.
also inclusive of young adults. It's also about 1 in 5. 1 in 24 will have what a professional would consider to be a serious mental illness, and about 1 in 12 will have a substance abuse disorder. Mental illnesses are hard to treat or cope with. Many people who have a mental illness do not want to talk about it. But mental illness is nothing to be ashamed of. It is a medical condition, just like having heart disease or diabetes, and they are definitely treatable. The mental health field has come a very long way in what we know about how the human brain works, and treatments are available to successfully manage mental illnesses. An important thing to note is that mental illness does not discriminate. It can affect anyone regardless of one's age, gender, income, social status, race or ethnicity, religion or spirituality, sexual orientation, background, or any other part of cultural identity. While mental illnesses can occur at any age, 3/4 of mental illnesses begins at age 24, which is why it's such an important to talk about with the young adult population. It is not always clear when a problem with mood or thinking has become serious enough to be considered a mental health concern. Sometimes you can just have a depressed mood, and that is normal. At times, it can be depressed when a person experiences loss of a loved one, a change in life, such as a loss of job or moving. But if that depressed mood continues to cause stress or gets in the way of your normal functioning, then that person may benefit from professional assistance. So if this is true, how do we know what to look for and what are some common mental illnesses that you may encounter? 3 of the most common disorders among young adults are anxiety, depression, and addiction. Anxiety disorders are very common, and anxiety is a reaction to fear or stress. Everyone feels anxious sometimes, such as when speaking in front of a group like I am doing right at this moment. A person with anxiety, they may feel his or her heart beating faster, or maybe short of breath, or even feel sick. Normal anxiety can usually be controlled and does not last much longer than the situation in which it starts. When anxiety becomes excessive, involves unfounded fear of everyday situations, or interferes with that person's life, it may be an anxiety disorder. Nearly 30% of people will experience an anxiety throughout their lives. Depression is also common. It is a potential serious medical condition that affects how a person feels, thinks, and acts. The primary signs of major depression are that a person feels sad or has no interest or pleasure in normal activities for the most part of 2 weeks. Some of the activities that they normally would enjoy, they lose interest or appeal in. You can also see changes in appetite, changes in your sleep patterns, whether you're sleeping too much, you're not able to sleep at all. You can become agitated. You may have feelings of worthlessness or guilt, problems thinking or making decisions, a lack of energy, or you may even have thoughts of death or suicide. And we'll talk a little bit about that, what you can do in those situations. Depression is more intense and is longer lasting than normal sadness. And adults experience major depression about 7% of the time during a given year. Some people may express depression differently, so it's important to look at the different signs. Addiction is also a common disorder. It is a chronic brain disease that causes compulsive substance use despite harmful consequences. Many young adults will experience both addiction and other mental illnesses at the same time. Stopping substance use is just one part of the recovery process, and a relapse can often occur during recovery. Addiction affects many aspects of a person's life, so treatment must be wholehearted and that it needs to address the whole of a person in order to be successful. There are support groups like Alcoholics or Narcotics Anonymous that are central for this recovery. So with these disorders, there is recommended treatment that can be given by a licensed professional. The one main treatment that most people think of when they think of mental illnesses is psychotherapy, or that's sometimes called talk therapy. And this can include several types of techniques that a therapist can prescribe, and they are specific to whatever disorder that you may need. Some therapists may recommend medication, but I recognize that not everyone is open to this type of treatment. Just as many people take medications daily for diabetes or high blood pressure, taking a medication for a mental health condition is no different. It can help calm anxiety, lift depression, improve attention, and you need to discuss your concerns with your mental health professional if that's the route that they are recommending. There are also things and treatments that you can do personally that may be recommended, such as exercise, yoga, relaxation, support groups, and things of that nature. When it comes to spirituality in the treatment of mental illness, studies show that people involved in a religious or spiritual group of some kind have a lower risk of premature death or illness than those not involved. And the fellowship, goodwill, and emotional support that can be offered by a religious community will promote healthy living and mental health. And so that's why it's very important for us as a church to get involved with the mental health and wellness of our young adults. So I will turn it over to Kristen now, who I think will take it from there and talk a little bit more about that connection.
That's wonderful. Thank you so much, Star. Go ahead, Kristen.
I'm grateful to Star for laying out such an incredible outline of the clinical perspective, because so often we don't hear that. My husband just got home. So often we don't hear the clinical perspective, but I've been asked to actually lay out, Star and I discussed for a brief moment separating, and I'll be laying out the pastoral care from a theological perspective. So what we're really talking about here is spirituality and mental health, and the intersection of those two things. This is a human dignity issue. We're talking about illness of the brain. We talk about theology of the body, but we don't really talk about theology of the mind. But to begin, no one has it all together. in church, we really like to look like we do. We like to look like everything's polished and we have absolute faith and everything's put together. But the truth of the matter is, no one's got it all together. When it comes to mental health, often it requires a vulnerability to share our authentic selves, the real suffering, the real pain, to be true and vulnerable. And so often, particularly in our culture, we can share a false self. Facebook, Instagram, what you choose to tell people is who you are, and that's just not accurate. I would make the argument that prayer is a powerful and necessary part of a holistic response to mental illness. NCPD has discussed, and most pastoral care books discuss 4 pillars. There's social, the presence of family and friends and community; psychological, which the psychological pillar helps you to understand the effects of the disease; biological, which is medical care, which started a great job laying out, but also spiritual. Spiritual is considered one of the 4 pillars. We're talking about belief and prayer and welcoming community. So with those pillars understood, with prayer and spirituality as one of the 4 legs, I'd like to also clear up a couple of misnomers regarding that intersection of faith and mental illness. The first one is, if you're dealing with a psychological illness as a Catholic, you are not alone. The second one, if you're dealing with a psychological illness as a Catholic, you have not failed somehow. Just like you wouldn't tell someone with cancer to pray it away, don't tell someone with mental illness to pray it away. Mental health isn't a moral failing for which prayer is the only treatment. God is not punishing people with mental health challenges. God is not testing people. That's just plain bad theology. Theodicy says, the branch of theology, theodicy says, why, if we have a benevolent, loving God, do innocent people suffer? And really, the idea that God's testing us or that God's punishing us is just plain not theologically grounded. Instead, let's take a moment to figure out, where is God in this? While it's important to be like Christ for the people in your life who struggle, it's okay to recognize you're not Christ and you'll not be the ultimate source of healing and happiness for them. I'm going to go back to that point. God is loving and healing. God is not testing and punishing. Christ provides grace, doctors, community, medication, psychotherapy, groups like Alcoholics Anonymous and Narcotics Anonymous, and healing. Did everybody see how that blended together? God is present to us through prayer, medicine, community, mental health professionals as the ultimate healer, as the true healer, and is coming to us in a variety of mediums as we experience suffering. Suffering happens. We are human beings, and this is part of the imperfect human condition. But I ask you to think about St. John Paul II as a witness. As he aged, as it became harder and harder for him to get up and to move, as we watched him suffer, he did it publicly. And that suffering wasn't from Christ. The fact that he was able to take that suffering and present it to Christ as a sacrifice and a love, and that Christ understood suffering because Christ was on the cross, one of the most painful ways a human could ever suffer, that could bring him closer, could help him better understand pain and suffering of others. He witnessed for us that as part of this suffering, we can find our Lord in a deeper way. As part of the struggle, Christ is even more present. As we respond as ministers, we have to remember that pastoral care is a piece of discipleship. One of my favorite pastoral care definitions comes from Klepsch and Jackal, and they said that it's healing, guiding, sustaining, and reconciling. If someone reaches out about mental illness, don't dismiss them. Love them. Meet them where they are. See the person, not the diagnosis. I challenge you to listen to their story and reach out frequently, remembering that, I'll be honest, spending time with someone experiencing a mental illness or currently experiencing depression or addiction or anxiety can be challenging. It can be hard to be the person who sits there if someone's really in a dark place. But presence is often all you can do, and it's often enough. Remembering that they're sick. So how do we ensure ministry doesn't add to mental stress and anxiety, but rather that our churches are field hospitals for those who need support and accompaniment? Remember, our churches, our parishes, our young adult groups, our after mass coffee and donuts, our triage. Our role is not primary care. That's for licensed certified professionals. Instead, we can do triage, and we can very intentionally become a welcoming community. In my last couple minutes, I'm going to give a little bit of a pop quiz on suggestions for welcoming community. So ask yourself the following questions. Is mental health ever in the prayers of the faithful at your church? Do you ever pray for addiction, people experiencing depression or anxiety? Does your parish have anything in the bulletin about local resources for mental health or 800 numbers? Are healing masses advertised as masses not only for people with physical ailments, but also for people with mental health concerns? Do you ever name depression and anxiety as opportunities that people could come to healing masses? Are caregiver and family support groups invited to meet at your church? People are more likely to join things when it is in their sacred space. What about referral? Has your parish staff been trained on referral? Have the leaders of your young adult group? The vast majority of our country has a network of local mental health resources. Have you ever invited them to come and do a coffee house roundtable where they set up tables and tell people about the resources that they have? For kids, for adults, for families, for marriages? And then what about providing training for the entire community on mental health? I ask, what are our Catholic communities afraid of? Back to you.
That was really, I was scrambling to write down all of that, Kristen. That was really wonderful. Thank you so much for providing both the clinical perspectives, Star, and the theological perspectives. You know, you made such phenomenal points between the two of you, and some of the, and you've already addressed a lot of the questions that came in from the registration forum as I flip back and forth here. You know, the first of which was the most prevalent, you know, mental health, you know, issues that we're seeing with folks is anxiety, depression, and addiction, you said, Star. And then kind of best practices with community to support that. So some of the scrolling slides that you see here, I wanted to just highlight that we will give you all a link to some resources that we've been collecting nationally, locally, and we invite you all to email me any sort of local chapters that you know of. We have a few states up and running from this Google Doc that we have. Catholic Charities is a really amazing one. And the one that you see that was before here, that we were scrolling back and forth to was NCPD, and they have some really amazing resources that we have. And this is, sorry, pardon me, I'm coughing a little bit here. It's the National Catholic Partnership of Disabilities. They have some really phenomenal resources. This is a PowerPoint, and we'll send you the link to that as well. It's in those resources pages. So that's what I was kind of scrolling back and forth behind the scenes about, because folks that were asking about particular challenges they're finding in the field are looking for resources. So Kristen, you just left us with a great deal of questions that we can be asking ourselves, and one of the biggest things that we're finding that with so many folks is that there is that, you were both addressing this kind of stigma that there is around mental health, that people don't want to talk much about it, or, in that theological connection that you were making, Kristen, that you can't pray this away. It's not one of those things that God is actually in grace, doctors, healing groups, and present through those things. So I really appreciated that. I want to open it up, and then Paul, please feel free if you had any thoughts before we go to the group here.
Well, one of the things that one of the concerns that really raises up for a lot of young adult ministry is that there's also the stigma, not just of ministering, but even of how to navigate with a community as they, like, somebody with mental illness engage with other young adults. My experience has been that I've watched communities gather, and the person with the mental illness comes, and then there's this gradual moving away of some of the other people in the community, leaving that person sometimes isolated and alone. And perhaps it causes a discomfort for others. And the challenge has been, I know for me as someone who's coordinating or observing that, is how to both call out that kind of that shifting, but also realizing that there is fear and ignorance of people, of not knowing how to handle that. So both to teach and yet also to kind of remind them that this is not the way of moving. But for many, it seems like a natural phenomenon, a natural reaction. There's somebody in that space that is different, and yet I'm not sure how to respond. We're called to minister to all, and yet sometimes when that space becomes divided, and sometimes it's a quiet division, and even it's a division that gets unnoticed even by leaders. And so I'm naming just a couple realities that I think are present in this situation. It was one of the reasons why we wanted to raise this up, because too often I think we just kind of, let's just not talk about it. Let's just let that be. We'll ignore it. Hopefully that person won't be offended, or hopefully maybe, but I don't think we can move that way anymore. I think that I think it's a betrayal in some respects of the ministry itself by allowing things to perpetuate like that, and to almost we just don't speak about these things. So I raise all that up, and I'm kind of wondering, either Star or Kristen, if you have any thoughts about that, because that's a lived reality in many young adult ministries, either planned programs or in a parish community, whether they're communities like small groups. There's a variety of settings that this could happen in, and I see that you're kind of nodding your heads, meaning you probably are familiar with that phenomenon. And I just wonder if you can speak to what should be, what kind of things would you respond? How would you respond to that?
Well, for me, I think just like you said, it's a reaction to not talking about it for so long. The church is historically silent on mental illness and mental health issues. And that is the first place where we have to start. We have to start having the conversation. Like Kristen so eloquently brought up, we have to do things in our weekly services and with our communities that needs to address these issues, talk about it, attending seminars like these where you can learn things, and so you don't have the fear, right? Because we are afraid of what we don't know. The more we learn about it, the less that fear is present. So just continue to talk, continue to learn more and more, and just having, I think, an open mind because also, as we talked about, mental health conditions run a wide array of issues and problems, and we all are going to be encountering it in some way or another in our lifetimes. And so, removing that stigma that we have to shun this person and keep them away is a big thing, is because it's a part of each and every one of us. And it's something that we should be open to and open to just learning and just being with that person.
Yeah, thanks so much for that. Um, when you were talking about mental health, I just kept thinking mental health is everything that we have going on in our lives. It's you said foundational for our thinking, our resilience, the key to our personal well-being, our relationships, how we view life. That's, if that doesn't yell ministry, I don't know what else does. I mean, that's I think what Pope Francis is really calling for is ministry with young. All ministry needs to be pastoral care as ministry, and I'm hearing in that, this idea that pastoral care is deeply concerned with mental health, and that is the value of our relationships and how we see one another and how we view our image of God. So thank you so much for that, Star. Kristen, you're more than welcome as well to respond if you like to Paul.
Well, I think that one of the blessings that our church has given us, well, I absolutely would like to reiterate what Star has said about not having enough formal dialogue, formal documents, formal statements from our church in regards to mental health and mental illness. I would like to remind everyone, I guess, about the beauty and the depth of Catholic social teaching in regards to this. Catholic social teaching is calling us to go to the peripheries and to first be present to the vulnerable. And that if we can give preferential option to those people, they should be the first in line. They should be the first welcomed. And even if we're talking in the context of Catholic social teaching, which everyone thinks is going to a soup kitchen or going and giving money overseas or doing an immersion trip, but really it's when you're in your living room for Thanksgiving and your cousin shows up and that cousin battles addiction and he's here again. What does he want now?
Yeah.
That's where Catholic social teaching, the rubber meets the road.
Yeah.
And if we as a community can integrate mental health and mental illness as part of the dialogue around really being people who live by Catholic social teaching principles, human dignity, I truly believe that we would be in a position where we can have that dialogue openly and it's not threatening. It's part of the canon of who we are as Catholics.
And you spoke you spoke of mental health and mental illness, and I think I think it might be good to also just name those as distinct categories, and yet related, yet distinct. And I think that's something that we also need to just be conscious of. That. So I don't know if there's any thoughts on the distinction and and also the relationship.
Sure. Star covered that, I think, earlier, but did you want to reiterate that, Star?
Sure. So they're often used interchangeably,
Right.
but basically for mental illness is what we would consider a disorder or something that causes a significant amount of distress to your everyday functioning. And mental health is your overall well-being. So just everything like Tracy said, wellness, resilience, how you function on a daily basis.
Thank you.
I want to I'm going to go to some of the questions here because I think it's a follow-up to what we've been saying. We kind of have two that I'm thinking might be related. We have one from Adam Gancho, and I'm very sorry if I'm pronouncing that incorrect. Ganacho, I'm very sorry if that's wrong. We're going to go with Adam because I think I'm butchering this. He says, I think the question that many parish leaders have is at what point do we refer to a clinical professional? Our pastors are a great resource, but they can only do so much before it needs to be brought to a professional level. So when do we as parish leaders refer to professionals? That's the first question. I'll just leave that one there. Do you have any advice for Adam and other parish folks?
I think for me, my advice would be anytime that you can recognize someone is struggling is a good time to refer to a professional.
Yeah,
There are some immediate concerns that would be an automatic referral, but I think people often wait until you get into that dangerous state. But if you are noticing someone, then referral to a professional is just another part of pastoral care because it's
hmm
offering them extra support. So obviously, with those immediate things, if you see someone is a danger to themselves or to others, that would be one thing. If they are completely withdrawn and they have a loss of a support system, that would be another. I think those are the two major things that I would see.
yeah. Thank you, Star. The follow-up, and Kristen, you're welcome to respond as well. One of the follow-ups we have from Diana, and this is one that I've been talking a lot with ministry leaders about, and I'm hoping, Diana, that it's similar to what you're writing here. She wrote, can you recommend ways of lovingly encouraging someone to seek additional help for mental health issues they may bring to us, especially for us in triage? How can we be loving without appearing dismissive? I think that's a follow-up to that question from Adam, is that when do we know, like you had responded, when do we know when to refer, but then how do we do it with pastoral sensitivity without looking dismissive as the triage folks that we were all talking about?
Do you want to start and I'll pick up?
Sure. So I think just doing it with care and sensitivity. I think displaying empathy to their person and, if we go to someone and we think that they may need a referral, just to offer it with love and care and, after support and listening in kind of a group type of manner. So I think if we do it in a welcoming way and non-dismissal, like you were saying,
Yeah.
and also in a way that presents itself that we may not understand, but we are supportive. And so I think that's important too.
One of the, I just love working with Star because she and I are like, we're quite the little dream team.
I love it.
One of the recommendations that I mean, we don't hesitate to refer people when they come up to us and they're coughing and it sounds a little bit wet or deep of a cough. We don't have any problem turning to someone we've barely met and saying,
Yeah.
have you had that looked at? Like
Right.
we don't pause.
Yeah.
Did you talk to your doctor about it? Because you're also thinking in your head, do I have whatever they just coughed at me? But we don't hesitate in regards to biology, like body. This is also biology in many ways.
Yeah.
And one of the things that I would suggest is so much of it has to do with the follow-up and the context by which you're making that referral request. It can't be, I walk up to someone I have never met before, I have never shown respect to, I have never listened to their story and said, hey, you seem kind of off. Have you considered?
Right.
That's ludicrous. No, just don't do that. It's in the context of relationship, of trusting relationship. So you sit down and you say, hey, you want to get a cup of coffee and just sit down and talk for a little while. You sit down, you have that conversation, and then as part of the conversation, you lovingly say, because Jesus wasn't nice, Jesus was loving. Jesus said, get behind me, Satan. Jesus threw over the table. Jesus left and came apart for a while to rest, even though people needed him. Jesus modeled for us that sometimes you stand up and you say, no, for your greater good, for my love of you, I'm going to stand on a wall here and say, no, I'm going to love you instead of just being nice to you. And I would, when we turn to someone and say, I love you enough, we've built enough of a relationship, I love you enough to say, I think maybe you might want to talk to someone. As a matter of fact, I'd highly suggest it. And I can't be the only one, because I care about you. And I think this could be good for you. But then you have to follow up. You can't drop that relationship because you feel like you handed off the hot potato before the music stopped. You have to be the person who 6 months later, they're going, my counselor is really making me crazy, and laugh.
Yeah.
And go, yeah, but we stick through it, huh? We stick through it. My counselor is making me angry and I don't want to go anymore. But you know what? That's what counselors do sometimes, because they're calling you out and they're trying to make you a better person. So stick to it. But you need to be the person, and you need to be the community. I would dare say having one person is an unhealthy situation.
Yeah.
You need to be the community that is in context of this referral. And then as you're coming through it, you have each other to support, and you also have follow through.
Yeah.
Because it's not in the moments when they're in the counselor's office, it's when they get back and they're sitting alone at home that it becomes harder to continue a healthier lifestyle. So context in my mind has so much to do with us moving people into a space where they see hope. So I would place that out there.
That was beautiful. Both responses were beautiful. And it's just drawing to my mind all the connections to be made from everything you've both talked about. We're talking about in Christus Vivit and what the Pope is talking about, we're talking about changing a culture of ministry, and so the stigma to mental health is coming from an inability to talk about it. It's not put out there, as you were saying, Star. It's historically, the church has been silent on it, so if we are raising it up publicly and seeing our ministry as pastoral care, not event planning, not activities, as pastoral care informing relationships, then we can practice that empathy, displaying that empathy of talking with somebody. And then there isn't so much of a stigma about bringing it up to somebody, because the life of the parish has been talking about it, or the community at large has been talking more about it and trying to break down those barriers. So there's so much overlap in where a lot of the questions might even be coming from the fact that we don't talk enough about it, and coming from the fact that ministry needs to be pastoral care, rooted in pastoral care. So yeah, I appreciate that so much. We have a couple other questions. I do have some, and I'm trying to get through here to see how many we've answered already. So I've got some from the registration list, and we have a couple more coming in. Emily Sutton, she was saying, kind of as a response, and maybe a little question follow-up as well, she said, we need to remember words like depression and anxiety aren't bad words. As we get to know people, we can eventually just ask a person what we think they may be suffering, if we think they're suffering straight out. Just by asking, you're not putting the thought in their head. She's saying that. And I wonder if you all would like to respond to that. It might even be welcoming for the person to find that someone has even noticed that they could be struggling with somebody, something like that. And so perhaps it's not saying any sort of diagnosis, because nobody here would do that unless they're a trained professional, but just saying, you may be saying the words. What do you think about that, Kristen and Star?
I think definitely being able to say the words is acknowledgement, right? So if we are in conversation with someone and we can bring it up and talk about it, then they may feel heard in a way that they have not before. And that's a big push for someone to get help and seek healing, is to be seen and heard and feel that they're understood, and they have experienced empathy and a connection with someone, and that they have support. And so by saying the words, bringing it up, definitely pushes through that support to someone who is suffering.
Yeah, absolutely. We have, Chris has resources that he shared there for the greater Houston area. And then he also said he's got a couple of links there, which is great. And I think when we record these, Chris, those will download with everything, so I can add them to the resource list. Thank you so much, Chris. And then we have Yasmin. She was saying, she was wondering about the substance abuse along with mental illness and health in general. I don't fully know the question. Maybe if there's a connection between substance abuse and mental illness, any thoughts that you had on those? I'm not sure about the question, but that could be what she was saying.
Well, substance abuse is classified as addiction, so it is a mental illness in and of itself, but it's
Perfect. Yeah.
also comorbid, or that's what they mean by saying that it happens at the same time as another disorder.
Okay.
So it's a both and, really.
That's a great clarification. Thank you, Star. Kristen, anything else on that?
No, I mean, I think that complication happens in regards to mental illness and also mental health. You know, you lose, if you're already experiencing anxiety and depression, which often go hand in hand, then you experience a grief or a traumatic situation that occurs, loss of a job, loss of a spouse, loss of a loved one, suddenly self-medication through alcohol, through drugs, through sex, through all the ways that we medicate in our society, that's not unusual. Then we've got the complication of layers. And it's not really the responsibility of the minister to unpack those layers as much as to name that layers can exist, and possibly see some of the behaviors as symptomatic and a reason to turn and say, I practically see that you're doing the following things, and that concerns me.
Mm-hmm. And Chris has the question, and I think it's going to what you're saying of all of these layers, and you might have read his question when you were responding there, Kristen. He said 2017 USCCB commissioned a study on college campus ministry that found students reported struggling most in the areas of pornography and mental health. Pornography can become an addiction. Can one of you talk about the intersection of addiction and mental illness? So I think we talked about substance abuse. We haven't talked about pornography, and I wonder if there's anything you could offer about that as well.
I would say that we should view pornography in the same vein as substance abuse. So it is an addiction. It's the same chemical reaction that happens that causes addiction and fuels addiction between the two. And so just as Kristen was saying, those layers will come about, and that's just another escape, another way to deal with our issues that we have in our everyday lives or with other mental illnesses that we may be experiencing.
Wonderful. Thank you, Star. There is the question that's coming up that we've heard. We've talked a little bit about it, but maybe I'll just read from what James was saying. He kind of has two. So, and I think they're related, James. Just let me know if I'm wrong. Not to be silly, but what are our presenters' views on where the socially awkward fit in the mental health bandwidth? And I think his follow-up is, I find that many of my challenges in hosting young adult ministry, events or whatever, in hosting things. It's similar to what Paul brought up, managing the awkward or quote creepy person who's trying to relate to their peers or potentially trying to find a boyfriend or girlfriend and creating dissonance. Do you have any thoughts on how ministers, and I think and I heard that when we were at the Young Adult Ministry Summit in Chicago, I talked with some ministers about the same thing. So I'm hearing a lot on that kind of question. So I wonder if you could speak to that.
Well, I think we first have to kind of think about what we mean when we say socially awkward, right? Mm-hmm. That can mean a lot of different things, and it doesn't necessarily denote
by whose standards.
Right. Yeah. Whose standards are you comparing it to? Are they awkward to you? Is this a notice thing by the entire community? And either way, whether it is associated with a mental illness or not, I think it's important to just break that stigma, that awkwardness, does that mean isolation? And so we're still called to be in community with everyone, no matter how they, relate to us. We are called, especially as leaders in the church, to relate to everyone and bring them, you know, maybe find ways to bring them in and create a less awkward situation. And sometimes that's just as simple as creating an open environment where they can express themselves in a way that is comfortable to them.
Kristen, any thoughts?
Well, I'm pretty awkward overall. I'm an awkward type. And I have had times in my life where I was not social developmentally where my peers were. Late blooming is tough, but I don't think that's what we're talking about. We're really talking about a situation where someone is lacking the basic social mores to participate in a community. And that is a skill, a toolkit that counselors often provide. How do you manage when you walk into the room and you feel anxious about introducing yourself, so you just stand there? What are some tools we can use in order to do that? This is why professional counselors are a gift. It's not, welcome to my office, here's 3 different things you have to do and a medication you have to take. Medication could be part of the toolkit, but really there are also social conventions that can be offered. My belief is that not everyone needs to be everywhere on the bus. There's this old leadership book that I read many, many years ago, which somebody's going to write in the comments is like only 4 years old, but I feel old, so that's
I identify
where not everybody needs to be the driver on the bus. Not everybody is trained to be the photographer on the bus. Not everybody should be the person doing the welcoming on the bus, but everybody has a space on the bus. And I do believe that as church, we're supposed to have everybody on the bus. But what role they play, you would not want someone who struggles with social concern, with social interaction, to be the hospitality minister for your group. But maybe you could provide a specific role. Maybe there's something, maybe being the photographer, maybe collating the digital videos and sending out a video once a week. You never know what somebody might have an interest in and a skill in, that they could build some of that self-esteem and resilience because you're utilizing it. That wouldn't put them in the wrong chair on the bus. Because that's often, in my experience, one of the challenges is that ministry isn't defined. Oh, everyone's welcome and do whatever you want. And what ends up happening is you have people who are trying to show they're interested, trying to invest, but no one's asked the question. Star and I have discussed discernment. No one asked the question, so what are the gifts you bring to our group, and how could we discern how you can use them best? And that question, which is a question that we need to be asking constantly, Jesuit educated, is also the experience of placing people in a situation set up for success, instead of placing people in a situation where they're floundering and they may not have the coping mechanisms to deal with things. I have found that shy people often like to be behind the camera, for example, instead of in front of it. And that makes them more comfortable. Clearly, I don't have that problem. But finding out where people are coming from and what their gifts are and what their passions are can help fit them in a way where they feel most at peace. And that's what we're trying to create, a community where people feel welcomed, gifted, and at peace.
And I think that's the key there, is that creating the community, not creating the program or the event, the community that the event is hosting. It is an event is a way to create that community. And so instead of seeing, I think you know, for me personally, and this is my own reflection, so everybody tell me if I'm wrong, I'm open to that. But I think we're so used to in ministry, you know, going back and telling our boss how many people we got, how many people showed up, this numbers game. And so we worry, it becomes, because that, again, I mean, that's a reality, and I'm not downsizing that at all, because then your pastor is, or boss or whoever is like, you can't get the numbers, you can't have the job. You know, like, this is a reality that people live in. But it drives the mentality that, so if somebody is there making folks feel awkward, whatever standard of awkward that is, people won't come back. So our numbers are down. And instead, what is very radical in changing that is that ministry is pastoral care, that events are community forming, that they do something. I talked with one of the diocesan directors in upstate New York at the summit in Chicago, the Young Adult Ministry Summit in Chicago. And he said, I'm not going to say his name, so I hope it's okay I'm saying it. He said, you know, we've been doing Theology on Tap and other events like that for years. He goes, I don't know right now what they're doing. You know, like, are they forming community or are they events? You know, and they don't have to be one or the other. They can be both. And I think it's in the way of looking at ministry with young adults from a different lens, from a different perspective, and from a different starting point, you know. And but again, we're talking a culture change in our churches, because that has to go up against people who are paying our salaries, if we have a salary. And if we don't, well, maybe we're lucky. Maybe we're lucky because they can't shut us down. We just need to find money some other way, some other side hustle, you know. But I think there might be, we'll be close to the end here. I wanted to say there's one more question from Sister Adelina. Any tools to help families? So we've talked a lot about church and ministry. Any tools to help families address the issues at the family table? I think that's a wonderful question, Sister.
So I think with families, it has to start the same way we do with individuals, in creating that community of support and having the resources available in our parishes that we can refer out when need be, to connect others, so they can talk about it in each other. And also, when, like Kristen was saying, counselors give support tools and skill sets in order to help deal with those family issues. And so having that available to go to is important. So just knowing where to go and creating that community, I think, are the two biggest things.
Awesome.
Yeah, I am always concerned when we aren't caring for the caregiver. You know, the spouse of the person who's going to the counselor doesn't always go to the counselor.
Mm.
And I really wish they would. I wish people would take advantage of the fact that if someone you love is sick, if someone you love had cancer, they would have cancer support groups at the hospital, at the cancer care center. During chemo, they sometimes have support groups while people are busy getting their treatments. We need to also remember that the caregivers are drained. And that the people who love people who are experiencing addiction, people who are experiencing depression, people who have attempted suicide, when we are dealing with people who are giving and consistently trying to manage something that feels unmanageable, they need a place to go that is safe as well. I am a big fan of providing people the opportunity to just sit together and pray together. And that doesn't necessarily mean sharing your family's stuff. You can just sit. We're going to be providing anybody who's caring for anyone prayer service. So if you have an elderly parent, if you have a child, if you're a parent at all, if you're a caregiver, come and pray. It provides people with the belief that they're not alone. And more often than not, if you'll out loud, and we're gonna close with this, and I know Star and I are both closing with the same bullet points. If you say it out loud, we're gonna have a prayer service for healing, and we're inviting people who are caregivers for those experiencing mental illness and addiction to also come and be prayed for and prayed with. It changes the dynamic. They then know their parish actually cares that they're at home. One of the books I read, and I'm going to misquote the title, and I apologize. I'm sure someone has it on the notes. Is no one brings a casserole to your house when your child is depressed.
Mm.
That if your child has cancer, everybody shows up and wants to help your younger children and wants to do, but the stigma that wraps around mental illness is going to prevent people from caring for the caregivers and caring for the unit that is trying to bring this person to health. So whatever we can do as a community to continually outreach and support, I just think breaking down the stigma, though, is of course going to be the point. And that was a wonderful segue, because now we can do our closing.
Yes, absolutely. So yeah, I absolutely invite you both to, we'll wrap it up here, and I want to hear your final thoughts for everybody. I'll take my camera off and put it back on when we're finished, but what would you like to leave us with, my friends?
I would just like to thank everyone first for joining this webinar. That is the first step, right? As for ministry leaders in our parishes, the things that we can do to help our young adults is, one, just being knowledgeable and learning and caring to learn. That is the main thing. Being open to the possibility of including everyone in a sacred space, talking about things openly, breaking down that stigma, realizing that mental illness is not a punishment and that it affects all of us, and just being empathetic to that, and really, really being as Jesus was, and instilling hope in a person that we are going to be a support. We are there to lean on. We can offer you help as far as a referral, but also remember that it just doesn't go there. Once we refer the person, then we also have to support them on their journey. That's what pastoral care means. And so I would just like to end with that and hope that we can all just get a little better in supporting one another on this journey.
The Harry Potter analogy, I guess, would be the best way to call it. Let's call it the Voldemort principle. In Harry Potter, the villain for many books was not referred to. They would not say his name. He was he who shall not be named. And because they were so afraid of him, they were afraid of his name, he was allowed to move and grow and disintegrate things without being addressed. Silence on a subject gives it anonymity and it gives it power. When we say something out loud, when we speak the word, when we say the name, it's manageable in a different way. It's not vague and unknown. It's a named disease. It's a named disease with symptoms, with proven ways of addressing it, with the ability for a community to talk about it. When we fail to say things out loud, we perpetuate the stigma and we eliminate the empowerment of the people who most desperately need it. We need to say out loud that it's unacceptable to be silent as a community in regards to when 1 in 4 and 1 in 5 people are experiencing this. We can't be silent. At a panel recently, I made mention of the fact that if 1 in 4 people in our community randomly turned purple, we'd be having purple prayer services every couple of days. We'd be doing a special purple day of recollection, and we'd be doing all kinds of special experiences, and people would be wearing I stand with purple. Here's the problem. We have purple. We have 1 in 4 people. We have 1 in 5 people. We have family members and best friends and godparents and cousins. We have people who really need the church community to become welcoming, not to become psychotherapists, but to become welcoming and to become prayerful places of community. So I beg of you, all those who are on this webinar, all those who will eventually see this webinar, people are struggling. Openly pray, openly name, and break down the stigma, as Star had said, because by openly doing that, a faith community can acknowledge, can welcome, and can heal.
That was beautiful, both of you. I don't know that I have any words left. That was one of our most wonderful webinars, Star and Kristen. Thank you so much for that. I wanted to add, and I am just so grateful for your wisdom and your counsel and your spirit, both of you, and for your ministries. I mean, our world is a better place because of the two of you. So thank you so much from the bottom of my heart. I also want to make sure folks that know, those that register, that I gave all the questions in advance, and feedback everybody's had since the October and November webinars, because they overlapped on mental health a little bit. I gave those to our speakers, and I went through many of them, and they were almost all addressed. So I just want everyone to know who registered, who couldn't attend, who can watch this later, that your questions were definitely addressed throughout the presentation, and addressed very, very well, I believe. So Star and Kristen, thank you both so much. Paul, would you like to give a couple announcements?
Yeah, well, first, I also want to express my thanks. You know, one of the things that the Bishop Caggiano just this past week at the USCCB General Assembly in Baltimore said to the bishops that we need to keep asking when it comes to young people and young adults, who is not at the table? Who are the people that are not at the table that we as a church need to engage in? And there are many young adults who are not at the table, and sometimes it's not because they have chosen to leave us, but because we have chosen not to acknowledge them. So thank you, both of you, for naming that which must not be named, but actually should be named. And so thank you, and I hope that we can continue to name those who are not around the table, and that young adult ministry is not a club. It is not it is not a social group. It is a field hospital on the move, engaging those who are not around the table, who are not in our midst, and even those who are at our table, but who need that accompaniment and support. So thank you for highlighting this as one area. Coming up in December, we are talking about another group that is not around the table, but needs to be, and that is the call to have pastoral care with relation to migrants, refugees, travelers, those on the move, and those who are actually 1 in 5 young adults is also, you know, so talk about another statistic there. 1 in 5 young adults is a migrant, refugee, or immigrant in this country. That is a significant amount of people, again, more purple people, and that we need to be engaged with. And so the issues related to migration are something we're calling beyond the border, because people often say, well, I'm not in Texas, I'm not in California, this doesn't apply to me. But migrants and refugees are in all 50 states. They are in all dioceses of the United States. Even if people say, well, I don't see them, well, they're there. And so we can't use the excuse anymore. We just don't see them, so they must not be here. Studies show migrants, refugees are there in your midst, whether you know it or not. And so, and many of them are young. Many of them are in their late teens, 20s, and 30s, who are in our communities. And so we're going to talk in December, quite appropriately, on the Feast of Our Lady of Guadalupe, about the experience of how do we do young adult ministry, whether we're in Alaska, Washington State, Florida, Texas, or California, or somewhere in the middle. No matter where you're from, that this is something that applies to you. So if you are starting to excuse yourself, just like in this webinar, we can no longer do that. So this is what we're moving on, kind of the third part of this series. And who knows, maybe we'll extend and have a part 4 of a 3-part series and a part 5. because there are many people out there that we don't see that we need to be engaging in pastoral care with for our with our young adults. So so this will continue, but we know for sure next December we'll be talking about migration and how it relates to young adult ministry. So I look forward to joining Tracy again on this format for that conversation. And I look forward to hearing with all the great things that will happen as a result of this conversation. So again, thank you, Star. Thank you, Kristen. You truly make our church more wonderful because of the advocacy and ministry you do. So that gives me hope. So in that hopeful spirit, I pass it on to Tracy, another person who gives me a lot of hope.
And so to that, tell us what was great about this, what we can do differently. I read your survey responses, and I also, when they're really wonderful, I send them on to our speakers, and then if we have room for improvement, we work on those. And so one of which was adding questions to the registration form. So please be thinking of your questions that you'll have in advance if you can, because we like to get them to our speakers. Any questions you have for next month's webinar. And it's also couched in Advent as well, that Mary and Joseph were migrating as well. And so there's some powerful, Christian connections we're going to be making there as well. So yes, the survey there, Sean's helping us out with the links at the bottom. And we'll make sure, I'm going to email everybody who is on this webinar and everybody who registers. That's why I keep saying the word register. I sound ridiculous about it, but that's the only way I can get you this information, is by sending it to you if you sign up and give us your email. So I can give you the resources list we're compiling. I also really invite you to send any local regional resources that you know of that are very good, that your dioceses use. And so we'll get, and so Sean's posting the link to the survey for the webinars, and then the link for the resources is right there too. So go ahead and click on those. And I just thank you all one more time for joining us. It's such an absolute joy to be on the webinar journey with Paul. I really look forward to these, because as a lifelong learner myself, I am always trying to learn more, and mental health and pastoral care is an area where I've truly blossomed in my newer understandings from these webinars. So thank you for joining us. And as always, the Loyola Institute for Ministry here, we have an online program, and we also have a focus area in pastoral care and counseling. So think about studying with us if you're considering going back to school. So thank you again to our fabulous speakers. You did such an amazing job today. And I look forward to hearing more about your ministries as you all go forward from here.
Yeah.
Thank you. Goodbye, everybody. Thank you for joining us.